Welcome back to Today's Health. In this segment, we're going to talk about treatment for a heart attack with cardiologist Dr. Samman. Dr. Samman, now once you arrive to the hospital, you think you're having a heart attack and you need to go to the cath lab to have a procedure to unblock the arteries. Can you explain to us what the balloon angioplasty is all about?
The first step, you're brought into the room. You'll lay down on a table, not the most comfortable one, it's a narrow table. And after you're cleaned up, you're covered, we access the arteries. We need to get to the arteries of the heart through one of our, what we call peripheral artery. The previous access we use more commonly is going from the groin, what we call the femoral artery. And sometimes we go from the wrist up to the heart. Once the patient will feel a needle stick, just numb up that area. Once it's numb, you shouldn't feel anything else. A catheter gets threaded up to the heart, and we can see in the picture the route that we can take. We're starting from, this is a picture from the femoral artery. Our catheter is threaded from here, goes up, this is the blue one, goes all the way around and back to the heart. And we can see it here, is going back to the arteries of the heart. As you remember, we talked about the one to the front and one to the back, and we have special catheters that we use to cannulate either one of the arteries. Once we take the pictures, that's the road map. We know where the blockage is, how severe the blockage, and what we need to do about it. Once we do that, then we can get on and do the angioplasty. And I have a video to show you a little bit what we're going to do into that issue. Because once we have the catheter, we have a wire that goes down. As you see in this artery, this is the artery to the front, and we saw a blockage there. We can see it right there, very tight blockage, and the artery going to the front, the LAD. And then what we have a very fine wire that we thread slowly through the catheter, across the blockage, and we put the wire at the end, and then we advance a stent or a balloon, which is this segment between the two dots, inflate the balloon through a device from the outside, and as you see, that blockage that we saw earlier is gone. What is the stent? The stent is a metal mesh that opens up the artery and keeps it open, so it prevents it from collapsing again. We have different kind of stents. Some people, we only use a balloon. Some people, a balloon and a stent. And it depends on the anatomy. It depends on the location. Most of us can get away with one stent. Some of us may require multiple stents. And when we do the cardiac catheterization, we may have only one blockage in one artery that's causing the problem. We may have multiple blockages. And a lot of time, we address the one that got us in trouble on that day, and we let the rest wait until subsequent time. Could be during that same admission or brought back to the hospital to be done. But the most important thing, as we talked earlier, is to get to the artery, putting the wire, putting the stent, restoring the flow to the artery as quickly as we can. As I mentioned earlier, we have that 90 minutes window. We don't want to get to 90 minutes. We want to get to the 40 and 50 minutes, or even less if we can, because the quickest we can get to it, the less likely we're going to have a permanent damage to the muscle of the heart. And that's really our goal. We want to preserve that muscle. With everything we do, our main goal is to keep that pump working.
Now, how soon after the procedure, when you put a stent or a balloon in, would you know if it's been successful?
Angiographically or by picture, I know right away. When I take a picture, the stent looks good, the artery is open, the blood flow is good, I know this procedure is done. The only difference is how much damage do I have? Am I left with a significant damage or not? Sometimes it takes a while for the muscle to recover. When we're done with the cardiac catheterization, we may take a picture of the muscle of the heart, or we may do an ultrasound of the heart to tell us about the muscle of the heart. The muscle may not be moving in that segment. It doesn't mean it's permanently damaged. It may be just needing some time to recover. And sometimes it can take up to 4 to 6 weeks to fully recover, or to get all the recovery we're going to get, in addition to certain medication that helps the recovery of the muscle. So in looking at what we call angiographic success, before we leave the room, we know there's angiographic success or not. But how much damage, how much permanent damage we have, it may take us up to 4 to 6 weeks.
Now, what is the recovery time after this procedure?
Commonly, assuming everything is in order, we're in the hospital 3 to 4 days, and we're gone. If we did the cardiac catheterization from the groin, the patient is laying in bed for about 6 hours to make sure that area where we put the catheter is sealed. If it's from the wrist, they can sit up right away because we can control the bleeding from the wrist in a much easier way. They're up and walking by either later that day or by the early next day. The important thing is certain medication they're going to be on with no interruption. It's very important to be on aspirin a day. And there's a class of medication, Plavix, Effient, or Brilinta, that are very important to take when we have a stent in. And that class of medication, one of those 3 medications that I mentioned, need to be on board for at least 1 year, because that stent is a metal. And the blood doesn't like to come in touch with metal. It will clot. So what's going to happen, that stent is going to clot and we'll have another heart attack, much worse than our first one. That class of medication, in combination with the aspirin, reduces the risk of a clot forming. It doesn't eliminate the risk, but it reduces the risk. So it's very important that our patients stay on that combination of medication. And I tell them, you cannot stop them unless your heart doctor tells you it's okay to stop them. In addition to other medication that helps the muscle recover, heal, and reduces the risk of having significant damage or another complication.
Dr. Samman, this has been great information for our viewers. Do you have any closing comments?
Well, thank you first for inviting me. Heart attack, unfortunately, is a disease that's not going to go away. Statistics is showing us it's less common now than it was before. Statistics show us death from heart attack is less than it was before. And the reason for that, one, we're paying more attention to it. We're seeking attention, medical attention earlier. And we have tools, including the angioplasty and stenting, to help reduce the risk of heart attack and dying from a heart attack. And we have medication that helps us reduce our risk of having problems down the road. But most importantly, above and beyond that, is preventing heart attack. And that goes back to what we talked about earlier, eating right, exercising, and definitely not smoking.
Dr. Samman, thank you for joining us today.
Thank you.
Stay with us. We'll be back after this message.